Dengue fever is a serious illness. It can cause severe flu-like symptoms, including high fever, severe headache, pain behind the eyes, joint and muscle pain, rash and mild bleeding. In some cases, it can develop into severe dengue, also known as dengue hemorrhagic fever, which can be fatal if not treated properly. It is caused by a virus. This virus belongs to the flavivirus family and has 4 different serotypes, meaning a person can be infected up to 4 times, each time with a different serotype. This virus is spread through mosquito bites. Specifically, the Aedes aegypti and Aedes albopictus mosquitoes are the primary vectors. These mosquitoes are most active during the early morning and late afternoon. Millions of people get infected every year. The World Health Organization estimates that there are about 390 million dengue infections annually, with around 96 million resulting in illness. Dengue is a problem in tropical and subtropical areas. Countries in Southeast Asia, the Pacific Islands, the Caribbean, and Latin America are particularly affected. Urbanization and population growth in these regions have contributed to the spread of the disease. These areas have warm climates. The warm and humid conditions are ideal for mosquitoes to breed and thrive, increasing the risk of dengue transmission. They also have the Aedes mosquito. This mosquito is easily recognizable by the white markings on its legs and a marking in the form of a layer on the upper surface of its thorax. This mosquito carries the dengue virus. The life cycle of the Aedes mosquito includes the egg, larva, pupa, and adult stages, with the entire cycle taking about 8-10 days under optimal conditions. The number of dengue cases is increasing. Over the past few decades, the incidence of dengue has grown dramatically around the world. Factors such as increased travel, urbanization, and climate change have all played a role in this rise. This is partly due to climate change. Changes in temperature, precipitation, and humidity can affect the distribution and abundance of mosquitoes, leading to more frequent and severe outbreaks. Warmer temperatures help mosquitoes thrive. Higher temperatures can shorten the development time of the virus in the mosquito, increasing the likelihood of transmission. This leads to more opportunities for transmission. Stagnant water in containers, discarded tires, and other debris provide ideal breeding grounds for mosquitoes. Effective mosquito control measures are essential to reduce the risk of dengue. Dengue fever can be deadly. Severe dengue can cause plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Early detection and access to proper medical care lower fatality rates to below 1%. However, with proper care, most people recover. Treatment focuses on relieving symptoms and includes rest, fluids, and pain relievers. In severe cases, hospitalization may be required to manage complications. It's important to know the symptoms and how to protect yourself. Preventive measures include using mosquito repellent, wearing long-sleeved clothing, and ensuring that living areas are free of mosquito breeding sites. Public health efforts and community participation are crucial in controlling the spread of dengue. Dengue fever doesn't spread directly from person to person. Unlike the flu or common cold, you can't catch dengue from being near someone who has it. The virus requires a specific vector to move from one person to another. It spreads through the bite of an infected Aedes mosquito. This mosquito is the primary carrier of the dengue virus. When it bites, it injects the virus into the bloodstream. This mosquito is recognizable by its black and white stripes. These distinctive markings make it easier to identify, but they are not the only feature. The Aedes aegypti is also known for its aggressive daytime biting habits. When an Aedes mosquito bites a person with dengue, it takes in the virus. The virus then resides in the mosquito's salivary glands. This process is crucial for the transmission cycle. The virus multiplies inside the mosquito. This incubation period can last from 8 to 12 days, depending on environmental conditions. During this time, the mosquito becomes a more efficient transmitter of the virus. Then, when the mosquito bites another person, it transmits the virus. This new host can then develop symptoms of dengue fever, which include high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding. These mosquitoes breed in stagnant water. They lay their eggs in any container that holds water, no matter how small. This includes natural and artificial containers. This includes places like old tires, flower pots, and uncovered containers. Even a small amount of water can serve as a breeding ground. Therefore, it's essential to eliminate standing water around homes and communities. understanding the mosquito's life cycle is crucial for effective dengue prevention. By knowing where and how these mosquitoes breed, we can take steps to control their population. This includes using insecticides, introducing natural predators, and educating the public about the importance of keeping their surroundings clean and free of stagnant water. Dengue fever symptoms vary. Some people have mild symptoms like a fever. Others experience severe symptoms that require medical attention. Common symptoms include high fever, headache, muscle and joint pain and rash. Nausea, vomiting and pain behind the eyes are also possible. In severe cases, dengue can lead to dengue hemorrhagic fever or DHF or dengue shock syndrome, DSS. These are life-threatening complications. Diagnosing dengue fever involves a blood test. This test detects the presence of the dengue virus in the blood. Early diagnosis is important for effective management. There's no specific cure for dengue. Treatment focuses on relieving symptoms. This includes rest, fluids, and medications to reduce fever and pain. Severe cases may require hospitalization. Patients might need intravenous fluids and close monitoring. Early medical intervention improves the chances of recovery. Prevention is key. Reducing the risk of dengue means avoiding mosquito bites. This is especially important in areas where dengue is common. Use mosquito repellent. Wear long sleeves and pants. Stay in places with air conditioning or window screens. These measures reduce the risk of bites. Mosquito control, fighting back against dengue. Reducing mosquito breeding sites is essential for dengue prevention. This involves community efforts and individual actions. Remove standing water around your home. This includes emptying containers, cleaning gutters, and changing water in flower vases regularly. Support local mosquito control programs. These programs use various methods to reduce mosquito populations. Community involvement is key to success. Dengue outbreaks, a global concern. Dengue outbreaks occur worldwide. These outbreaks can overwhelm healthcare systems. They also impact economies and communities. Climate change contributes to the spread of dengue. Warmer temperatures and changing rainfall patterns create favorable conditions for mosquitoes. Global travel and trade also play a role. They facilitate the movement of the virus to new areas. International cooperation is crucial for outbreak response. The future of dengue control, research and innovation. Scientists are working on new ways to control dengue. This includes developing vaccines and new mosquito control methods. Dengue vaccines are available in some countries. These vaccines offer partial protection against the virus. Research continues to improve vaccine efficacy. Genetic modification of mosquitoes is another area of research. This approach aims to reduce mosquito populations or their ability to transmit the virus. Stay informed, stay safe. Your role in dengue prevention. Dengue fever is a growing concern worldwide, affecting millions of people each year. It is crucial to understand how we can contribute to preventing its spread and protecting our loved ones. Dengue fever is a serious health threat. It is caused by the dengue virus, which is transmitted through the bite of an infected Aedes mosquito. Symptoms can range from mild fever to severe conditions like dengue hemorrhagic fever, which can be fatal if not treated promptly. But we can all take steps to protect ourselves and our communities. Using mosquito repellents, installing mosquito nets, and ensuring that water containers are cleaned regularly can significantly reduce the risk of mosquito breeding and bites. Stay informed about dengue in your area. Keep an eye on local health bulletins and updates from health officials. Awareness is the first step in prevention. Knowing the current situation in your community can help you take timely actions to protect yourself and your family. Be aware of the symptoms and how to prevent mosquito bites. Common symptoms include high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding. Using mosquito repellent products and wearing long-sleeve clothing can help prevent bites. Early detection and prevention are crucial. If you or someone you know shows symptoms of dengue, seek medical attention immediately. Early diagnosis and treatment can prevent complications and save lives. Healthcare professionals are trained to provide the necessary care and support. By working together, we can reduce the impact of dengue fever. Community efforts, such as cleanup drives to eliminate mosquito breeding sites, neighborhood meetings to raise awareness, and collaboration with health officials are essential in the fight against dengue. Simple actions can make a big difference in the fight against this global health challenge. Every small step counts, from applying mosquito repellent and covering water tanks to using bed nets. Together, we can create a safer and healthier environment for everyone.